drawing the patient's curtain. Hello, my name's Abby. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Bobby J. Peterson, November 11th, 1977.
And I verified that on her wristband. Are you having any pain today, Bobby?
No, feel pretty good.
That's good. Can you tell me what you've eaten in the past 24 hours?
Some fruits, vegetables, water, and a soda pop.
Patient seems very nutritious to appearance and based on assessment. Can you tell me why you're here today, Bobby?
Just a general checkup.
Can you tell me where you're at?
Doctor's office.
Can you tell me what year it is?
2019.
Patient is alert and oriented ×4. How are you feeling today, Bobby?
Feeling pretty good.
Patient is calm, cooperative, has a calm facial expression, no angry facial expressions noted. Posture is erect and comfortable. Patient appears well groomed, not misshapen. No physical deformities are noted. Speech is articulate. Patient looks appropriate for stated age. Alrighty. Can you just pull up your sleeves and I'm going to take a quick peek at your skin. Patient has a noted tattoo on left lower forearm. Skin is dry, smooth, warm, and intact. No obvious lesions noted, no abnormalities noted. Skin pigment is appropriate for ethnicity. And I'm just going to give you a quick pinch. Turgor is intact in the skin without tinting, so patient is hydrated. Okay, Bobby, I'm just going to ask you to cover the same eye as me. And we're going to do a quick eye test, okay? Can you tell me when you see my fingers?
No. 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 No.
And other eye?
No. 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 No.
Cranial nerve 2 is intact. Irises are equal in size and shape and color. This scleria is clear and white with no redness. Can you just pull your eyes down just like this for me? Conjunctiva is pink. All right, can you just look at my nose for me, Bobby? I'm just gonna test your pupil reactivity real quick. And then without moving your head, can you follow my finger with your eyes, starting up here in the upper quadrant? All right, pupils are about 3 millimeters in diameter, equal, round, reactive, and accommodating equally. Alrighty, and we did a whisper test on you earlier, and there was no noted concerns with your hearing, showing us that cranial nerve 8 is intact. And with the reactive test and the quadrant test, we noted that cranial nerves 3, 4, and 6 were intact with your eyes. Can you raise your eyebrows for me and smile for me?
At the same time?
One at a time would be fine. Face is symmetric and cranial nerve 7 is intact. All right, I'm just gonna do a quick sensation test on you. Can you close your eyes for me? Do you feel that?
Mm-hmm.
What about this?
Mm-hmm.
And this?
Mm-hmm.
Sensation is intact, showing cranial nerve 5 is intact. And I'm going to palpate lightly, checking your sinuses. Frontal and maxillary sinuses are not swollen or tender. Did you feel any pain upon palpation? So no tenderness, and we're not palpated. And then I'm going to, can you open your jaw for me and close? No crepitus noted, no crackling. Did you feel any pain upon the opening of your jaw? No tenderness around the mandibular joint. And I'm going to palpate your lymph nodes, pre-auricular, post-auricular, occipital, and mandibular. There was no noted tenderness. Did you feel any pain?
No.
And so lymph nodes are not tender and non-palpable. Can you close one nostril and blow through? And in the other one, nostril patency is intact. All right. Can you stick out your tongue for me? All right. I am going to test your gag reflex. All right. Teeth are white. No noted lesions were in the mouth. Gag reflex is intact, showing that cranial nerves 9 and 10 are intact. And since we stuck our tongue out, cranial nerve 7 is also intact. Lips are subtle, moisturized, no lesions noted. No lesions noted in the mouth. Do you feel any pain within your mouth?
No.
No pain in the mouth. Tongue is midline, pink, and no lesions noted there as well. All mucosas are pink, so everything looks great there.
Okay.
We are going to move on to test your range of motion within your neck.
Okay.
So can you push against my hand? And then other hand. And then can you look down, go back, side, side. Range of motion is fully intact, showing that cranial nerve 6 is fully intact. When I palpated your lymph nodes, I did your cardioid pulses on each side, and they were 2+ bilaterally, showing strong pulses. We're just going to test your upper extremities real quick. Can I take your pulse? While I'm taking pulses, I'm checking skin. Pulses are 2+ bilaterally. Skin is appropriate for ethnicity. No lesions noted. Can you push against my hands? And then the other way. And then push down.
When I'm out here.
Push down. Push up. Strength is symmetric and adequate on both sides bilaterally. Now, Bobby, if you want to stand for me and face this way. Patient would normally be shirtless, but due to the situation where she's going to stay covered, I would be inspecting the patient's back, noting that the thoracic cage is symmetrical and elliptical, and that there's no noted lesions. Her skin is appropriate for her ethnicity. And then I'm going to palpate for lumps and tenderness. I feel no lumps. Did you feel any pain, Bobby?
No.
No tenderness noted. And then I'm going to check for expansion. Can you inhale and exhale? Equal bilateral expansion of the chest of the thoracic cage. And then I am going to auscultate with my diaphragm. Can you inhale and exhale for me? I have auscultated the posterior chest lung sounds, and the lungs sounded clear with no advantageous breath sounds. I am now going to percuss your post-vertebral angle. Will you let me know if you feel any tenderness?
Yes.
And then if you just want to bend over slightly, I'm going to palpate your spinous processes. Spinous processes feel fine, and you didn't feel any tenderness upon the percussion. So, and then we're going to turn around. We are going to inspect once again. Skin is appropriate for ethnicity, no noted lesions, and I'm going to palpate for lumps and tenderness. Did you feel any tenderness?
No.
I did not feel any lumps. I'm going to auscultate the lung sounds for the anterior chest wall. Can you inhale for me? Lung sounds are clear with no advantageous breath sounds. All right, can you sit back down for me, Bobby? All right, I'm just gonna listen to your heart a little bit. So if you just want to lean forward slightly and exhale slightly. I am listening at the base of the heart for murmurs, and there are no noted murmurs. I would palpate for the apical pulse, finding it at the midline in the fifth intercostal space. I would listen there with the diaphragm, noting a regular rhythm of 68 beats per minute. And then I'm going to inch my way back up to the base of the heart with the diaphragm. And then I would switch to the bell. And I would also take from the base of the heart back down to the apex of the heart. All right, we are going to lay down so that I can inspect your abdomen.
Okay. You need to come this way.
Okay, I was working on it so much. So we're looking at the abdomen. The abdomen is symmetric, the contour is flat, there is no noted lesions. We don't have, her skin is appropriate for her ethnicity. So our inspection is done, and I'm going to auscultate starting in the right lower quadrant. Vowel sounds are present. Vowel sounds are present and active in all four quadrants. If I did not hear any vowel sounds, I would listen for up to 5 minutes. I am now going to percuss, listening for tympany. Percussion yielded tympany as expected, and I'm going to start light palpation, checking for tenderness. Do you feel any tenderness, Bobby?
No.
No tenderness was noted, so we are going to go into deep palpation. No abnormalities are noted. The spleen and the liver are both palpable. All right, can you pull your shirt down and stand back up? And not stand back up, but sit back up for me. And can you pull your sweatpants up? So here I am inspecting for symmetry. She has bilateral symmetry within her legs. Her leg hair is sparse, is evenly distributed. Her skin is appropriate for her ethnicity, no abnormal pigmentation. She does not have any swelling or edema on either leg. I see no varicose veins. I'm going to palpate the dorsalis pedis pulse, the posterior tibialis on both legs, the pulses are 2+ bilaterally. Can you push up against my hands with your feet? Both legs. And then can you push down? Adequate strength is noted in both legs bilaterally. And that brings us to the end of our head to toe assessment. All right, did you stop